Although a lot of people think you need background in health administration to be doing health administration, I found just the opposite was the case, that the generalized skills that you get in running any kind of organization, human resources, budget, communications, strategic planning, and the like, are perfectly applicable to hospitals. And also I think there's some advantage in coming from a different field because you have a fresh perspective on things. One is being transparent and open about what's happening in the organization. For example, with regard to the finances and the personnel policies and all that. I've always found that it's very helpful for everybody in the organization to have the opportunity to learn about those things so that they can understand how you're doing, what changes need to be made, and why. And I've never understood people who keep that stuff secret from the staff, because you depend on the staff for carrying out the strategic vision of the organization. On the clinical side, here I kind of fell into transparency by accident on my blog when I started posting infection rates and the like. And it too is very powerful. It helps an organization hold itself accountable to the standard of care it says it believes in. Transparency in that regard has really nothing to do with comparing your institution to the one down the street or the one in the next town. I'm not talking about transparency for purposes of consumer choice. It's actually not clear that it's that beneficial to many consumers. But even if it were, there's a benefit to an organization itself in holding itself accountable by being open and honest about its performance metrics. And the important thing there is to do it in pretty real time. If you wait 2 or 3 years till the numbers are stale, they provide no value at all in terms of process improvement. It's like driving using a rearview mirror. We trust the people who work in the place. If you think about the people who decide to go into healthcare, they're incredibly well-intentioned people. They devote their lives to helping others, to alleviating human suffering caused by disease. They want to do well for those folks. They want to do well for the organization. So given that, why don't we assume the best about them? Assume that they want to do well. Assume that giving them knowledge and information will be helpful. Assume that their ideas about how to improve the organization are welcome, and treat them respectfully. I think the next 10 years in the healthcare business in the United States are going to be brutally difficult. The industry is facing severe constraints on revenue possibilities, whether it's private payers or government payers like Medicare and Medicaid. It's clear that rates, reimbursement rates, payment rates are unlikely to go up faster than the overall rate of inflation. And that's a big change from the past. So that's one thing. So revenues are not going to be there. Nonetheless, many of these organizations are not well organized to look at how they do their work and evaluate opportunities to improve the quality and safety of care, and also to improve the efficiency of it. Learn how to write and present very clearly. Still, even with the web and everything else, your personal ability to persuade other people in your organization that your ideas and your approach have merit depend on your ability to write in a way that's persuasive and clear, not email style, not texting style, but full-fledged sentences with good grammar and good spelling, and paragraphs with topic sentences. All those things that we were supposed to learn in 5th grade are very important. Likewise, get really good at making oral presentations.